Most people think diabetes is invisible until a blood test proves it. You go to the doctor, the lab work comes back, and that's the moment your whole world shifts. I used to believe that too, but after more than 2 decades of practicing medicine, I've learned something that changed the way I look at every single patient who walks through my door. Your body doesn't wait for a lab result. It starts warning you months, sometimes years, before any blood test ever would. And the very first place it speaks up, the very first place your body waves a red flag, is your feet. These are signs I look for before I ever order a single test. Signs that have helped me catch silent diabetes in patients who had no idea anything was wrong. And here's what I need you to understand. This video could genuinely change the trajectory of your health or the health of someone you love. So stay with me. Because what I'm about to share is the kind of information most people never hear outside a doctor's office. Just last month, I sat down with a patient, 67 years old, retired, healthy lifestyle, felt completely fine. He came in for a routine checkup. But before we touched any blood work, I asked him about his feet. He paused and said, "My feet have been a little numb for a while. I figured it was just age." I looked at his feet. He had 4 of the 9 signs I'm about to show you. His fasting blood sugar came back at 214. He had been diabetic for over 2 years without knowing it. 2 years, walking around, living his life, completely unaware. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people right now with a silent condition quietly destroying their nerves, their kidneys, their vision, and their feet. A $12 blood test can catch this early. But first, you need to know what to look for. So let's get into it. Starting with the sign that almost every single patient has already experienced and explained away. Sign number 1, tingling numbness, that familiar pins and needles feeling in the feet. I hear the same thing from patients every week. "Doctor, my foot just falls asleep sometimes. I was sitting with my legs crossed." And yes, that happens to everyone occasionally. But I always ask them one question: is this happening regularly without any clear reason? Because if the answer is yes, we need to talk about what's actually happening beneath the surface. Frequent recurring numbness or tingling in the feet, what doctors call peripheral neuropathy, is one of the earliest signs that blood sugar has been elevated for some time. The excess sugar in your bloodstream starts attacking the outer protective layer of your nerves. It's a slow process, which is exactly why most people miss it entirely. I use this analogy with my patients all the time. Think of your nerves like electrical wires. Every wire has a protective coating around it. That coating is what allows the signal to travel cleanly from your brain to your foot. When blood sugar stays elevated, it's like acid slowly eating through that coating. The wire still works for a while, but the signals get fuzzy. That fuzziness, that tingling, is your body asking for help. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most common complication, and it almost always starts in the feet. Tens of millions of people are feeling this right now and writing it off as nothing. Don't be one of them. My daily recommendation for every patient over 60, a 20 to 30 minute walk every single day. Not a jog, a walk. Movement is the single best thing you can do to keep blood flowing to your feet and protect those nerve endings. And start reducing added sugar in your diet today. Not next month, today. Sign number 2. This one my patients describe as the most distressing of all because it doesn't hit them during the day. It hits them at night when they're alone, trying to sleep with nothing to distract from it, a burning sensation in the soles of the feet. Most people chalk it up to being on their feet all day, summer heat, or just plain fatigue. And sometimes that's exactly what it is. But when a patient tells me their feet feel like they're on fire at night while lying perfectly still, I take that very seriously. Burning in the soles of the feet, especially at night, is a classic early sign of diabetic neuropathy. Here's what's happening. The nerves in your feet have been damaged by excess sugar, and now they're sending incorrect signals to your brain. Your brain receives a heat message even though nothing hot is touching your foot. Think of it like a fire alarm with a broken sensor. The building isn't on fire, but the alarm is screaming anyway because the sensor is damaged. That burning isn't coming from outside your body. It's coming from inside damaged nerve tissue that is desperately crying out for help. Research published in the journal Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often presenting 1 to 3 years before formal diagnosis, 1 to 3 years before the blood test confirms it. 2 habits I recommend here. Drink at least 8 glasses of water every day and add more fiber to every meal. Vegetables, legumes, oats. Fiber slows the absorption of sugar into your bloodstream, which is exactly what those damaged nerves need. Now pay very close attention here, because sign number 3 stops being uncomfortable and starts becoming genuinely dangerous. This is the sign that sends the most patients to the emergency room. They come in and say, "Doctor, I had a little blister from my shoe 3 weeks ago. It still hasn't healed." 3 weeks. They waited because they assumed it would close on its own. Most small wounds do heal on their own, but not when blood sugar is elevated. When blood sugar is consistently high, your body loses its ability to heal efficiently. The blood vessels throughout your body, including the tiny ones in your feet, begin to narrow and stiffen. Oxygen, white blood cells, and the nutrients that repair. Tissue simply cannot reach the wound fast enough. The wound just sits there, open, vulnerable, and slow to close. Imagine trying to water a garden, but your hose has a serious kink in it. The water is there. It's just not getting where it needs to go. That's exactly what high blood sugar does to circulation in your feet. The healing ingredients exist in your blood. They just can't reach the wound. And an open wound that won't close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 per year. Almost all of them were preceded by a small wound that was ignored. Tonight, after your bath or shower, sit down and look at both feet carefully. Look between every toe. Look at your heels. If you see any cut, blister, or broken skin, clean it, apply an antiseptic, and cover it. And if it hasn't improved within 48 hours, call your doctor. Not next week. 48 hours. Sign number 4 is hiding in plain sight. Patients see the skin on their ankles and lower feet turning darker, more reddish. They tell me, "I think it's just sun damage. I've always had dark skin on my ankles." And that may be true, but there is a specific pattern of discoloration I look for when assessing blood sugar risk. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin changes color as a result. You may see darkening, deep red, or even a bluish tint around the ankles. In some patients, the skin also becomes thinner and more fragile in those areas. I explain it to patients this way. Think of your blood as a delivery truck carrying oxygen and nutrients. Your feet are at the end of the longest delivery route in your entire body, further from your heart than anything else. When the roads narrow because of damaged blood vessels, the deliveries stop arriving on time. The skin, starved of fresh oxygen, changes color. It's a distress signal you can see with your own eyes, if you know what you're looking for. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months of warning sitting right there on your ankles. 5 minutes of ankle circles, toe raises, and calf stretches every morning. That small amount of movement gets blood flowing into your feet and can make a meaningful difference. Sign number 5 surprises my patients the most because it looks completely harmless. They've had it for years and never once connected it to blood sugar. "Dr. Mandel, my heels crack every winter. It's just dry skin." I hear that constantly. And yes, that's extremely common in cold months. but when your heels are cracking badly in the middle of summer, or when no moisturizer seems to help no matter how much you use, that tells a completely different story. Diabetes affects the autonomic nerves, the ones that control automatic functions you never have to consciously think about. One of those functions is regulating moisture and sweat in the skin. When these nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose their natural moisture from the inside out. No amount of lotion fixes the root cause. Think of your skin like a wall that needs to stay sealed. When those autonomic nerves are damaged, the mortar between the bricks starts crumbling. And those cracks in the skin of your feet are not just cosmetic. They are open doors for bacteria and infection. I've had patients come in with cracks so deep in their heels they were bleeding, telling me they had been applying lotion for 2 years with no result. That is not a skin problem. That is a nerve problem. Moisturize your feet every single night before bed. A good lotion or pure coconut oil works well. Apply to the sole and heel thoroughly, but never apply moisturizer between your toes. That trapped moisture breeds fungal infection. Now I want to pause for just a moment because we're halfway through and I want to ask you something directly. Have you noticed any of these signs in yourself or in someone you love? A spouse, a parent, a sibling? If the answer is yes, even for just one sign, go to the comments right now and type yes, just that one word. I read every single comment on this channel. If you have a question, ask it. If you're concerned, tell me. And if this is helping you, hit that like button right now. It takes 1 second and it tells YouTube to show this to more people who genuinely need it. Now let's keep going, because the next 4 signs are the ones most people never hear about. Sign number 6 is more serious than most people realize, because it's not just about your feet. It's about what's happening to your kidneys at the exact same time. Almost everyone I see with this tells me the same thing. I stand on my feet all day, of course they swell. And yes, occasional swelling from activity is completely normal. But if your feet and ankles are consistently swollen, and you're leaving deep sock marks every single evening, that changes the picture entirely. High blood sugar affects the kidneys, and the kidneys control your body's fluid balance. When kidney function is impaired by years of elevated glucose, fluid accumulates in the lowest part of your body, your feet and ankles. Think of your kidneys as the filtration plant for your entire body. Every drop of blood passes through them to be cleaned. When high blood sugar damages those filters, the system backs up and excess fluid has nowhere to go except downward. Gravity does the rest. You press your finger into the swollen area and the indentation stays there for a few seconds. That's called pitting edema, and it is not something to ignore. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the very first visible sign. When you rest, elevate your feet above the level of your heart, even a few inches on a pillow, and reduce sodium in your diet. Salt causes your body to retain water, making edema significantly worse. Sign number 7 is the one I see most often misdiagnosed, especially in men. And by the time they find out what it actually is, they've been living with it and masking it for years. I've been taking ibuprofen for the foot pain for months, Dr. Mandel. I figured it was arthritis, maybe an old sports injury. I've heard that story dozens of times. Sometimes that's exactly right, but sometimes the pain has a completely different origin, one that ibuprofen will never touch. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive. Instead of going numb, they start firing random, intense signals that your brain interprets as severe pain. Patients describe it as stabbing, an electric shock, a hot needle driven through the foot. Think of a car alarm damaged in a fender bender. Every few minutes it starts screaming for no reason. Nobody's breaking in. The alarm is just broken. That's what a damaged nerve does. The pain is completely real, but its source is nerve dysfunction, not injury. And taking ibuprofen doesn't fix a damaged nerve. What it does is mask a signal your body is desperately trying to send you. a landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently mistaken for arthritis or age-related joint pain. Every morning, 5 minutes of gentle foot and ankle stretching before you get out of bed. And every night, give your feet a gentle 3-minute massage, light circular strokes along the sole and up the ankle. Sign number 8 tells me how far things have progressed. When I see this, I know the damage is no longer early. Doctor, I've always had cold feet. My wife has had the electric blanket every winter for 30 years. I laugh with him. But then I ask, are your feet cold in July? Are they cold under 3 blankets when the rest of your body feels warm? Because that's when I become very concerned. Persistent cold feet, cold in summer, cold under heavy blankets, cold regardless of outside temperature, are a strong indicator of significantly compromised blood circulation in the lower extremities. Your blood vessels have narrowed and stiffened to the point where warm blood simply isn't reaching the tips of your feet in sufficient volume. Think of your blood vessels like a heating system running pipes through every room in your house. When those pipes narrow from blood sugar damage, the heat doesn't make it to the far end. The room stays cold no matter how hard the furnace works. The American Heart Association identifies peripheral artery disease caused by narrowed blood vessels as affecting over 8 million Americans, with diabetes being the single largest risk factor. Cold feet are one of its earliest and most consistent symptoms. The best response here is a 30-minute brisk walk every single day, not a stroll, a purposeful arm-swinging walk. This forces blood circulation into the feet and lower legs, strengthens blood vessel walls, and over time can begin to reverse some of the early narrowing. Start with 10 minutes if 30 feels like too much. The important thing is to start today. And now sign number 9. This is the one almost nobody ever talks about. I have never seen it covered in a patient brochure. Most people walk right past it every single day, but once you know it, you will never unsee it. During a foot exam, I look at the lower legs and the tops of the feet. And sometimes there is a visible absence of hair in those areas. The patient looks down and says, "Huh? I never noticed that." And that is exactly the problem. It's quiet. It's easy to miss, but it matters enormously. Hair follicles need a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs slowly stop receiving what they need. Over time, they stop producing hair entirely. Think of hair follicles like small plants in a garden. When the irrigation pipe narrows or blocks, the plants don't die immediately. They just gradually stop growing. That absence of growth is your body sending a visible message about your blood vessel health. A message you can see every single time you look at your legs. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients, a reliable and frequently overlooked sign that physicians are specifically trained to check for. Right after this video, look at your lower legs and the tops of your feet. If the hair is significantly thinner than the rest of your leg, or absent entirely, schedule a blood glucose test this week. Not this month, this week. Approximately $12 at any certified lab covered by Medicare. $12 that could change the entire trajectory of your health. We've covered a lot today. 9 signs, 9 chances to catch something before it catches you. And I want to be completely honest with you about something. One of the hardest parts of my job is sitting across from a patient who has had every single one of these signs for 2 years and is only just now finding out. Why? Not because they didn't care. They cared deeply. They just didn't have the information. You now have that information. So here's the one thing I'm asking you to do tonight. Just one thing. Before you go to bed, sit down and look at your feet. Take 30 seconds. Look at the skin, look between the toes, feel for numbness, check for any wound that shouldn't be there. 30 seconds. That's it. And if you see or feel anything on this list, call your doctor tomorrow. Not next week, tomorrow. Because the earlier you catch this, the more completely it can be managed. In most cases, through a change in diet, a daily walk, and a straightforward conversation with your doctor. You worked hard for the life you have, for your independence, for your health, for your ability to do the things you love. Don't let something as manageable as blood sugar take any of that from you, simply because nobody told you what to look for. Now you know. And knowledge, when you act on it, is everything. If this video helped you or someone you care about, share it right now. Post it on Facebook. Tag a family member, a friend, a neighbor. You might be handing them something they didn't even know they needed. Hit that like button if this was valuable to you. It truly helps more people find this information. And if you want more conversations like this one, I post a new video every single week. Topics that matter for your health after 60. Things I talk about with my patients that most people never hear outside a doctor's office. Subscribe now and bring someone you love along with you. I'm Dr. Alan Mandel. Stay aware, stay proactive, and please take care of those feet. I'll see you next week.